everybody. I'm Laura Rogers.
I'm Darla Oglesby. Thanks for joining us for Midday Live today.
Here's what's coming up on today's show. Do you suffer from arthritis, tendonitis, or carpal tunnel syndrome? We'll tell you about a new laser therapy that can treat those conditions. Dr. Clint Mallory and laser technician David Stem join us today from the Genesis Medical Laser Center. It's great to have you all here
Thank you.
today. And we're talking about this BioFlex medical laser system. I think I'm getting that out there right. But this is something that treats musculoskeletal pain. So let's talk more specifically about what we're referring to. What condition specifically is that?
There are a lot of medical conditions that respond well to this type of device. The main one is arthritis, plantar fasciitis.
Carpal tunnel syndrome.
Yes.
Tendonitis as well, it'll help with that.
Joint pain in general. Any type of pain that involves damaged tissue.
So it's something, maybe you have it in your wrist or even your back, different areas of the body it will treat.
Correct. A lot of neck, we treat a lot of neck and back pain.
Okay, so this is using a laser, and we hear a lot about laser therapy as far as hair removal. We were talking about this a minute ago. Can treat many different things. Is this the same type of laser that you would see or use in a spa?
No, this is a system that was designed exclusively to treat pain and has been FDA approved to treat pain exclusively.
Okay, so how long has it been around?
The system itself has been around for about 20 years. It was designed and developed in Toronto, Canada, where it has been used for 20 years, and it garnered FDA approval to treat pain in the United States in 2004. And what we're seeing is it's starting on the coasts, as most things do that are new to the United States, and it's slowly working inward. Genesis is one of only 52 clinics right now in the United States that uses this technology.
Okay, so 52, not a whole lot. Why don't you think more physicians are using this yet?
Well, I've been in practice 20 years as an interventional pain physician. And I was always looking for a better way to treat my patients without medications, injections, and to try to avoid surgery. I discovered this system 5 years ago. I had to go to Canada to learn about laser technology. This is widely used in Europe and in Canada. I think for someone looking for an alternative way to be treated without medication, narcotics, or surgery, this is a great option to look at. I'm not saying that you shouldn't pursue surgery if you need it, but this is a very non-invasive, non-painful way to get rid of painful conditions.
Okay, so how many treatments does it take is it something you go one time or several times?
No, typically patients start to see some improvement around treatment 3 or 4. The treatments are cumulative in that each treatment builds on the previous treatment. So again, 3 to 4 to see some improvement, and usually between 10 and 15 to completely eliminate their symptoms.
Okay, and what about the time commitment as well? So how long would a session last if you were going?
A session is usually 25 to 32 minutes, with the exception of lower back treatments and hip treatments are 45 minutes to an hour because of the depth of the tissue that we're treating in those areas, but typically around 30 minutes.
We normally like to treat people at least 2 times a week, and the results are quite astounding with this. And you know, who wouldn't want to feel better without medication or an injection or surgery? This is a wonderful way to help the body heal itself. Laser technology works by stimulating tissue growth. Any damaged tissue responds to laser treatment, much like a plant requires light to grow. Damaged tissue is unable to respond and use all the nutrients in the body, but by using laser technology, you stimulate certain enzymes within cells that promote healing.
Okay, so let's test this out. Do you mind?
Okay.
You want to try it?
Absolutely.
Okay. And
what we'll do is, for purposes of this, we'll pretend that you have carpal tunnel syndrome.
okay, all right.
And the carpal tunnel syndrome treatment, like most treatments, usually are five stages. We have 2 stages of red light, 2 stages with the infrared light, excuse me, and then a final stage with the handheld probe. And the difference between these stages is the depth of the depth of the tissue that we're treating. We saturate from the outside in. So, for instance, if we can just move this up,
All right.
and we'll strap.
Now, is there anybody that you would not want to use this on? Anyone that can't be treated by lasers? Is it somebody?
There are 2 conditions. Someone who has an active cancer, we do not treat them because
Okay.
it promotes tissue growth, and anyone who is in the first trimester of pregnancy, because during fetal development there's a lot of tissue growth occurring.
Okay. So they would not be a candidate for this, but so are we doing something right? I don't feel anything
It's
right
absolutely on.
now. Okay, so there's
And
really you don't feel anything going on.
Other
down
than
there.
possibly a little warmth, you know, around the 2nd or 3rd stage, but that's it.
All right.
And your pain can be eliminated, and it's completely non-invasive and completely painless, no side effects.
Yeah, I was just thinking, I probably should have asked before you did this if there are any negative side effects involved, but none that you know of.
None
as of
whatsoever.
Right now. Okay, so if you're interested in this, if you suffer from carpal tunnel, tendonitis, arthritis, then you can contact the Genesis Medical Laser Center. There's a website and phone number there on your screen. So thank you all, Dr. Mallory and David. Thank you for being here today. We appreciate it so much.